The 32-year-old woman who freezes her eggs can use her 32-year-old egg when she is 42. Why do we need to freeze time? Every egg that exists in a woman's ovary is in fact older than she is because it starts its journey in her mother's womb. We don't get to make new eggs after we are born. And we women of today want to have our babies later in life for various reasons. And why not? We can wait for the right man. We can wait to become the CEO. We can if we plan. Those good quality eggs that you take at 32 and freeze them, they can be used at 42, at 45, and again at 48, because that's how many eggs you'll get. The journey of an egg from conception to menopause, in the womb, we have 6 million eggs in the middle of the pregnancy. Most of those will degenerate before birth. At birth, there are only 2 million eggs in the ovary, and they continue to degenerate until puberty. At puberty, you're left with 500,000. Every month, for a menstrual cycle, a few eggs will wake up. In fact, they say a couple hundred eggs will wake up. Of those, only one is going to become the ovulatory follicle. The rest will disintegrate. And believe it or not, only 500 eggs out of your whole lot will ever become ovulatory eggs. Just a note to make here, that when we freeze your eggs, we take those that were going to degenerate. So that crop of 100, that gives us one ovulatory follicle. The rest we take to freeze. So we don't tap into your pool. We don't remove all your eggs. You will make your own babies, even if you don't use the eggs we freeze for you. By menopause, most of the eggs have degenerated, and that's the end of our reproductive capacity. This is a visual representation of how the eggs decrease from birth to 50. Let me give you one more. This is the same kind of graph, except that it puts fertility potential in categories in little boxes. Note at 31 that we say decreased fertility. Note at 41 we're saying end of fertility. So some of these graphs are a little harsh, but that's how it works. This slide is quite busy. There's quite a lot in it. Let's go through it slowly. It is egg reserve versus monthly birth rate natural conceptions. Look at the blue circles in the center. If you look at the monthly birth rate, it says 20%, but that is between 13 and 25. And at 25, it says monthly live birth rate begins to decline. Who would have thought that? Look at the difference between the monthly live birth rate at 25 and 45. At 45, read it says 1%, which means that there's a rapid deterioration in fertility potential in a natural cycle. That's not even the IVF cycles, because they perform more poorly than natural cycles. Remember that we are perfect. Nature is perfect, and we are only trying to imitate nature. So in a perfect situation, the clock is ticking, and at the mid to the late 40s, most of us are going to have very poor responses, not only to our own attempts to make a baby, but even with fertility treatment. There's more on that slide. We don't have to look at too much of that. Let's go on. This is a further bar diagram which depicts the same thing I've just said. And that is, at 25, your chance of a conception is close to 25%, but at 40, it's around 4%. Imagine that with egg freezing, we can put a graph the size of the 30-year-old in the place of the 40-year-old. That is amazing, and that's what can be done. In this graph, the black line again shows how fertility drops from 100% to 0%, excuse me, yes, in terms of fertility, 100% to 0% from 25 to 40. And again, like I say, some graphs depict it more harshly, so we're not saying at 40 it's all done, but try not to get that far without thinking about freezing. In this graph, we also see miscarriage rates. And the miscarriage rates increase on that red line from 24 to 44. And what does that depict? That tells us that the quality of the eggs that we have at that age are poor, and they don't make chromosomally normal babies. And nature allows us to wipe the slate clean, have a miscarriage, and try again, because the reason why human beings have 2 eyes, 2 hands, and 2 legs is because the best of us are selected to to past 13 weeks, which is the 3 months of pregnancy. So miscarriage rates is before the 3 months of pregnancy end. Going from here onwards is more startling statistics about abnormalities of embryos as we get older. Look that at 25 years old, 25% of embryos are abnormal, but at 44, greater than 80 to 90% of embryos are abnormal. There's quite a big difference as we head down into the late 30s, as you can see. If you look at this table as well, it says it differently. 1 in 475 babies will be abnormal. Actually, embryos will be abnormal because we hope we don't get to abnormal babies because nature will cause them to miscarry. 1 in 18 at the age of 45. This bar diagram shows similar things, just easier to see and interpret. The green bars are all the unhappy embryos, and see that at 43 how high that bar is. And look at the other blue bars, which tell us how many are actually normal at 43. So they go in opposite directions, and there's quite rapid increases and decreases in those normal and abnormal embryos as we head from 35 to 43. So this graph doesn't even take us into the 20s. This slide says clinical pregnancy and live birth rate. But this is not only this is not depicting what natural cycles do. This is saying that even when we do IVF and we succeed in making blastocystes, which are actually embryos, when we put them into your body, the 40-year-old patient will respond very poorly. Look at the live birth rate, which is the blue bar, and look at the clinical pregnancy rate. So even when we try to help, our hands are tied. The next slide doesn't talk about the fertility in terms of what we can do in a lab. Just interesting for me. If you look at humans versus the chimpanzee and the gibbon, I don't know what the first one is, but let's say, in the bottom row is how many weeks we carry our pregnancies to. And so we carry them to 38 weeks. On the left-hand side is how old we generally are, what our lifespan is, and that says 70. And look at that bar and how much time we have to make our babies compared to other animals. So from just before 20 to just after 40 is our baby making potential. Yet we live so long without being able to make babies. Okay, so let's move on. So how do you know if you're running out of time? We look at your ovarian reserve. The ovarian reserve is the engine of the ovary. And age is the most important predictor of ovarian reserve, as we've demonstrated with all these slides. The ovarian reserve, what is it? So it tells us how many eggs we have in the ovaries, how many are growing follicles, how many are antral follicles, I'll get into that just now, how many follicles will be stimulated by the medication we give you, which is FSH. It's also the natural medication or the natural chemical that your body makes to stimulate the eggs, but we give you higher levels to try and push more follicles into maturation. And eventually it tells us how many eggs will be removed when after we have stimulated you. We are trying to predict what your natural fertility is and when it is becoming low. We want to see what we can do to help you and what the outcome will be of the treatments we put into place. We want to tell you how much longer you have to make the babies you want. And we want to say to you we can predict the age of menopause. This is a fairly long slide, and I don't want to go into it too much. Suffice to say that the third point, results of the ovarian reserve test help us to differentiate which woman has a poor, a normal, and a high response to ovarian stimulation. It also tells us which person has critically low results that tell us that our ovary is in trouble. And it can be used to adequately counsel women against repeated and expensive treatments that are likely to give a negligible response. And it also helps us to give emotional and psychological support while we're offering treatments with better prognosis, example, donor eggs. So how do we calculate or determine the ovarian reserve? Quite a few points on that slide. I want to concentrate on the anti-Mullerian hormone, which is the second one in red, and the antral follicle count right at the bottom. The first one, age, as we said, which is the most important predictor, I've spent enough time on. Let's look at the ovary. That is the journey of an egg as it wakes up and completes its maturation in the ovary. On the left and on the top left are the sleeping eggs. They are the primordial follicles, and they become the primary follicles. I heard a bit of a talk before where we elaborated on them. But I'm looking at the ones on the top right-hand side, the ones that look like crocodile eyes. The antral follicle is amongst them, and the pre-ovulatory follicle is then the huge one, which tells us that egg is mature. So we count the number of antral follicles. You can see those are the ones that have woken up. I say the ones that are sleeping on the left-hand side, they don't have ears, inverted commas. They don't have receptors in essence. Once they wake up and they accumulate those cells around them that make that bushy look around it, those cells have receptors. They have ears to the FSH. So once they have ears, they wake up and we can talk to them and they can respond to us. Those are the ones that will make the batch this month. Out of those will be one pre-ovulatory follicle, and the rest we will save from degenerating with our freezing, with our stimulation. So those were going to be lost anyway. When you give us eggs to freeze for you, we're not tapping into your ovarian reserve as such, because we're only using those that would have degenerated that month and you would have lost anyway. So we use all of those that have ears, and we talk to them with a lot of FSH so that they can wake up and give us the eggs that we're going to freeze. This is what you'll see on the scan when your doctor scans you, because when we're looking at antral follicle count, which is a measure of ovarian reserve, we're looking at how bunched up those follicles are in the ovary. I like to say it's like a chocolate chip cookie, and how many chocolate chips do I have and how much biscuit do I have? So you can see as we get older, I've got more biscuit and less chocolate chips. I want the chocolate chips. I want to be able to help you when there are more chocolate chips. So the antral follicle count, as I said, is about counting how many eggs are waiting in those follicles for us to retrieve for you. We do add them up together, one and the other, right ovary, left ovary. And it is used to tell the woman wanting to fall pregnant naturally whether it is risky to wait. So we want people coming to us sooner rather than later when you're trying to fall pregnant, because we know that we can save some more eggs if we see you sooner. And we also then tell the woman about her chances of successful IVF, because it is good to go into a cycle having realistic expectations and not basing your IVF treatment and its results according to your friend who's 10 years younger than you. We also use it to predict the years to menopause, although it's not an accurate thing. It is an indication, and it's not really so that women can dread when they're going to be menopausal, but it is to say work fast if you want babies. So these are graphs that show us how much of an impact, or how much the antral follicle count tells us in essence, because it is something that's happening while you don't know it, so we want to know what is it telling us, and we want you to be aware of it. So if my antral follicle count is between 20 and 40, my chances of falling pregnant are excellent in the next 10 to 15 years. I've got time, and I've got that much of time to the menopause as well, 20 to 25 years to menopause. If I have less than 10 eggs, I need to do something quickly, and menopause is fast approaching. If I have less than 5 eggs, there's a minimal chance that anything you do or we do is going to save the day, and your decline to menopause is 7 to 8 years. If we look at it slightly differently, the response to stimulation, now this is not even natural conception, this is even when the best of science, the concepts that we use are being applied to you. Then if your follicles, if you have 3 to 6 follicles, excuse me, your chances of response is negligible. And if you have 5 to 11 follicles, your chances are reduced. And 9 to 16 follicles, we are happy that we can give you some good news. The anti-Mullerian hormone is another measure of ovarian reserve, and it is made by those cells that surround the egg, the fluff, the cells that I showed you in the picture before. If it is between 1 and 4 nanograms per mole, the woman is fertile. Under 1, the fertility potential is low, and less than 0.16, we don't even talk about fertility potential. We're saying to you, menopause is within 9 years. Look at this slide. This shows the decline in anti-Mullerian hormone again from the age 25 to the age of 43, and look at how fast it goes down. If you look at this slide, which then means a little bit more, I think, is that we can kind of predict how many eggs we'll get from your stimulation with our best efforts and the best amount of medication that we give you, because the engine, if the engine's not working well, we can give it as much fuel, we're not going to get the motor to move as it should. So if your anti-Mullerian hormone is above 2.3, we can get more than 20 eggs. If it is between 1.2 and 2.2 essentially, we might get close to 20 eggs, but we can even be as little as 3, and so we must beware. But look at the one above that. Between 0.17 and 1.2, less than or equal to 2 eggs. So women are very disappointed when we're working towards a pickup, and at the pickup we only find 1 or 2 eggs, and this is only talking number, because quality is still another issue. So of those, we can't even tell you that both will be good quality eggs. Under 0.17, we say it is not probably worth your emotional, psychological, and monetary investment to do a cycle. Yet people want to do cycles, and sometimes we accommodate them only to show them where the cycle can take them, because then only do they make peace with what we've told them, and they are happy to take the next step. Although it's a very expensive experiment. To us, it's not an experiment. It's a question of bringing the woman to the realization that we are at already. So, in conclusion, we have seen that there is a progressive and largely irreversible decline in female fertility from the age of 35 onwards. Ovarian aging is mostly genetic and unavoidable, and the increase in age accompanies the decline in the AMH and the antral follicle count, which we can see ahead of time and which we should be monitoring, if you let us. When we give it our best of what science can offer, IVF cannot overcome age, and the success of your IVF cycle is dependent on your age. So the message is freeze, and freeze early at a younger age to get better quantity and better quality. A note, freezing doesn't diminish the egg pool. Only those that woke up that month will be extracted, and they were destined to disintegrate anyway. The frozen eggs that we collect from you can make many pregnancies if we get them early enough, so we get the right numbers and we get the right quality. So even if you decided that you didn't want a baby now, but froze your eggs, and next month or next year you change your mind, you can try to make a baby naturally. You may well succeed. You don't need to use these eggs for the first pregnancy. You can use it for the second pregnancy when you're older, or for the third pregnancy. Maybe you don't use them at all. Maybe you have all your pregnancies naturally. But the frozen eggs in the bank make you give you time to play with your expectations of life and finances and marriage while you keep your eggs safe. So you need not use them. You can either donate them to science eventually, or you can donate them to a person who's less fortunate and didn't think of the plan you made early enough. You can discard them, sorry, it's such a bad thing to say, but if that is what you wish, you can. So freezing eggs puts you in a powerful position to be able to make decisions later on that you will be cheated of if you don't consider it. If you consider it and keep them ready and in the bank, your stress is less going into your pregnancy at 35 and finding the person you want to be the father of your children, and you can proceed without using them, and they're just insurance in the bank at best. Remember, the freezing technique is safe and it is successful. If you have not frozen your eggs and time is up, you may use donor eggs. We take donor eggs from young women with better ovarian reserve, and that translates into, as I have said this whole lecture, better ovarian reserve at a younger age translates into a good number of good quality eggs that serve you well. To get pregnant, to pass the 3 months of pregnancy, to have a live birth, and to have a chromosomally normal child. So freezing early is the trick. The following 2 graphs show you what the difference is between your own eggs as my own eggs as we age and what the donor egg does. The top row, keeping up at a 50% chance or even a 50% chance of having a live birth rate, is donor eggs. And look at the decline that is underneath that. This next graph also shows the same thing. The blue bars are the donor egg. They stay stable as we age. And look at what happens to our fertility potential as we age. So my final message, we can, if we plan, we can delay childbearing if we plan.